Hi. So I'm going to speak today about, again, a supply side issue, which is kind of what we've talked about so far. But this is a different sort of supply side. What we've heard about so far is more macro, and this is a little lower level. The example I'm going to use, because it is the one I know about, is the twin project that Kelly Klump and I have developed here at MSU. We developed it as a resource for MSU and for outside scientists to examine genetic, environmental, and neurobiological influences on health conditions. And we focus specifically, we have a really nice collaboration going with the Michigan Department of, it was Community Health, now it's Health and Human Services, and they're picky about it, that change. And what we do is we recruit twins via birth records. When they turn 3, we recruit them into the registry. We could go younger than that, but right now we're doing age 3 as our youngest age. So we recruit them via birth records into the registry. We recruit a couple thousand, 1,000 or so a year. We've assessed about 30,000 twins to date, and they all fill out a longish questionnaire, the parents do, of course, around various health conditions in the parents and in the kids. We don't just assess little kids, we also assess adult twins. Up to age, I think 50 or 50, I think maybe it's 52 now. So we get information on sort of the twins and their immediate family members. So there's a lot of self-report health data that to sort of navigate. So some wrinkles, some of which we've already dealt with whenever you've got a big resource like this. One of which is that we wanted to make sure it was used as a resource. So this isn't just for Kelly and I by any means. We developed a very general questionnaire, and our data, we have developed data use proposals and procedures. So this is a list of some of the disorders that we assess, just the ones A through D. And we also advertised a little bit. We've advertised a little bit around campus. We do things like this to hopefully increase advertisement. We've got, I think, 11 or 12 different groups using it now. Another wrinkle is that some of the twins are in really high demand. There are twins that everyone seems to want to access, and then a lot of twins that no one is that interested in. So how do you navigate that with a resource? How do you spread it out amongst different research groups? How do you make sure everyone gets kind of the core participants that they need? And that is a challenge. That is like an ongoing challenge, but it is something that we do. That is a struggle. What we've done so far is develop data use procedures. We have an advisory committee that helps us navigate these things, but it continues to be something that we struggle with. We've also got big data problems. One are sort of the infrastructure issues. So this is not only for the MTP, but the way that we've organized the MTP is we have, there's the broad MTP, we've got the questionnaire data that everyone, that people could use and analyze just by itself. But what a lot of people do is they use the MTP as something like a subject pool to identify twins for subsequent studies. And then they collect quite intensive data, half-day or day-long assessments on these twins, including things like fMRI, DNA for GWAS, daily hormone values in one study. We have dyadic interactions between parents and twins where they're coded twice a second over many minutes. So there's many ways scientists collect data, and a lot of them are now quite intense. And so when you have, so for an individual project, they can handle it, but when you ever want to merge everything back together, what you end up with is a lot of just big data commotion. Building on that, most people actually don't know how to analyze twin data, which was something I didn't totally realize when we developed the twin registry, is that this is a sort of specialized thing to do. It's not hard once you get the hang of it, but it is kind of specialized. And so it has been actually a hurdle for us where Kelly and I are having to do analyses for people and basically help them generate study designs and serving as co-Is of grant applications because they need someone with twin expertise. We have to help with recruitment. How do you design a twin study what's the best way to design a study for your question? And as I said, with analysis. I didn't mind that so much when I was a younger assistant, but now I feel a little, feel stretched a little thin, helping people with analyses. Still, we'll do it, but don't want to do it. So really what we've decided is that we need to kind of move into we're hoping to move into a slightly different model where we really think about a team approach. And that's where part of why I came to present here today was because I was hoping to get ideas for how to move that forward. So thank you.
Questions?